Hi, I'm Dr. Kevin Mailo, one of the co-hosts of the Physician Empowerment Podcast. At Physician Empowerment, we're dedicated to improving the lives of Canadian physicians personally, professionally, and financially. If you're loving what you're listening to, let us know. We always want to hear your feedback. Connect with us. If you want to go further, we've got outstanding programming both in person and online. So look us up. But regardless, we hope you really enjoy this episode. Hi, I'm Dr. Kevin Mailo with Physician Empowerment, and we've got another great episode lined up for you today. And we've really been, I think, recently digging down on this theme of, and this is a physician empowerment thing that we teach and have taught for years, the notion of you as the most important investment. I mean, we talk about finance and we talk about money, and those are obviously important. We have a masterclass dedicated to finance, and we've got our upcoming conference here, May 25th and 26th in beautiful Toronto, and we are going to be covering finance. But fundamental to that is the notion again of you as the most important investment. Your physical, mental, emotional health matters. And it's not just in terms of your ability to excel in your career, but it matters in terms of actually being happy. And I challenge, myself regularly on this issue. If I'm not happy now in my life, when am I going to be happy? So with that being said, I'm very excited to introduce you to Dr. Michelle Jackman. And there's like a big runway of introduction here, because Michelle and I go back last year, but in many ways, because Michelle is a pediatric obesity specialist based out of Calgary, married to an emergency physician, busy, active mom who does so much in terms of, because you're in beautiful Calgary, where you're much closer to the mountains than we are in Edmonton.
Yeah, we're lucky.
So you're a mountain cyclist, you're a skier, but you are also a physician coach. And we even did some coaching sessions together where you coached me, and I thought it was amazing because I had never gone through the process myself.
Thank you, Kevin.
And then on top of that, you are going to be coming to our conference in Toronto, May 25th and 26th, to actually speak and do a little bit of coaching for us. So again, very excited about working together moving forward. But I wanted to hear from you about your journey in the coaching space and why you feel like physicians benefit from this, because I know I certainly had. So with that being said, big long introduction. Please, Michelle, tell us a little bit about your journey through coaching.
Well, thank you. Thank you, Kevin, for the accolades. And I am definitely parent in progress. So I have not, sometimes I joke about being the jack of all trades, just like my last name, Jackman. Jack of all trades, but master of none. So I like to talk about myself as if I'm a work in progress, which is the wonderful thing about coaching, which has really opened up my world to a whole new realm of learning. And I feel like there's a whole other side of my brain that's been started to be exercised since going on this journey. So
yeah, it's great. I mean, one of the hot topics right now in ongoing professional development is the idea of coaching and mentorship. And there are some differences between the two, but medical schools, are already starting to introduce the idea of a coaching model to medical students. And that this is something we should probably not just be doing during our years as learners, but throughout our career.
Absolutely.
For ongoing personal development, because and professional development, because I think there's a struggle to know where are you at and where are you going professionally. So how did you get into coaching, Michelle, yourself?
Yeah, well, and thanks a lot, Kevin, for asking me to share the story. It was interesting. It was during COVID, and I think, as many of us and our colleagues and our fellow nurses and healthcare workers it was a really stressful time, especially in the emergency department, and having a spouse who is an emergency physician who, before the vaccine, we didn't know how this was going to impact patients. We didn't know what decisions people were going to have to make as frontline workers. We didn't know whether or not we were going to get sick or loved ones were going to get sick and how bad it was going to get. So it was quite a, when you look back on it, it was pretty traumatic time for everybody, right?
It was
It's
wild.
got a crazy
I
world.
was just talking about that with my
Yeah.
partner, a few years ago, like we were in masks and lockdowns. And I think for a lot of us, that was a time to reevaluate life, and not necessarily on a really existential level, but even just like, how busy am I? What am I really worried about? And should I be?
Yeah.
It's this opportunity to look at priorities.
Exactly. And that is sort of the quintessential coaching question. How can I take this crisis and turn it into an opportunity, turn it into an opportunity to pivot? So unfortunately, I have a spouse. I was at the time doing overnight calls. And I remember distinctly, we were coming back from a nice weekend away skiing in Fernie, which we have the fortune of going and visiting. And we were in the car, and I was driving back to Calgary, and I had a night shift coming up. And as an in-hospital pediatrician in Calgary, we do overnight calls still. And I was just dreading. I got this feeling like in my gut of dread. And then it just dawned on me to ask myself this question. Well, why are you doing this? Why are you doing this? And then I just kept asking this question of myself. And, I kept coming up with thoughts of, well, I love my work. I love being there at the bedside when a child is acutely ill and alleviating. I love supporting the residents. I love my work. So it wasn't that I didn't love my work, but I was at the time, as we all were, juggling a lot. And then I looked at my daughter, and she was 6 at the time, and kids really needed us. And I decided that needed to be my priority. My family needed to be my priority, and my health. And, it was getting to the point that, I wasn't sleeping. I had kind of lost my motivation. I lost track of why did I do pediatrics? Like, why am I dreading this? This is the career that I love. So I actually started working with a coaching group that was offered by a colleague of mine who's a friend, and she's an executive coach, Dr. April Elliott, for many of your listeners. And she did a group session, and it really created this experience for us to connect with each other. It was kind of like a virtual physician lounge that we've kind of lost, and we were all able to, have a community. So that was really powerful. And I joke with her, I'm like, the first session, I thought it was going to be a come by eye waste of time, April. She laughed. She said, well, I'm really glad you did. But then she really inspired me to actually start working with a coach one-on-one. And she also really was a wonderful support as a friend and colleague. And then I worked with a physician coach here in Calgary. He's a Dr. Nadeem Lalani, and he was wonderful. And that some of those sessions, it just really helped me gain that self-awareness and help me identify that I had options, and what I wanted for my family, and why was that important? Who was going to benefit? It was going to be my family, my daughter, my husband. I was able to be more present by pivoting out of night shifts and acute care so that I could put my own oxygen mask on and be mentally healthy and present. So the metaphor I like to use is like when you're mountain biking in the dark and your lights go out and you come across a meadow and there's like 6 different trailheads and you have no idea which one to take. Well, coaching was like my headlamp, like that came back on and helped me see that, oh, there wasn't just one path. There's like a whole bunch of paths. Like, I don't have to be stuck in this specific role, this specific rut for the rest of my career. I've got options.
I love it.
Yeah.
I mean, let's just stop there and unpack a little bit of this. But, I'm hearing something that we all go through. And thank you for just being so honest and saying is like, you're feeling burnt out.
Oh, yeah.
You're feeling tired, struggling to go into work. I'm impressed how the night shifts take a toll on us.
Yeah.
And the long hours take a toll on us as we go through the years of our career.
Absolutely.
And so just saying, okay, there's something going on. I'm not as happy in my work as I used to be. But then having the opportunity to explore it, right? To actually just speak out loud and say what you're feeling is very powerful, so that we're not just trapped and lost with our thoughts or ruminating or not thinking through things.
Absolutely. Yeah.
And so what's come out of your coaching sessions, as I take it, is this semi-structured way in which you sort of went through and explored an issue you were struggling with, and then getting to something very practical, because now you're doing something different, right, Michelle?
Absolutely. Yeah. So
tell us.
So yeah, and then I actually got inspired to become a coach myself, and thinking that this would not only help with my pediatric patients and families that are trying to make lifestyle changes and dietary changes around diabetes and other health chronic disease issues. I could also, I could become a better parent. I could become a better colleague. I could become a better listener. So because all of those qualities and skills, our coaching really just amplifies them. And there's an actual framework for doing this. So I think it's great that the medical profession is getting enthusiastic about it, right from medical school up to, and through the rest of our career. Because the reason why it is so powerful is that it's not someone that's evaluating you. It's a safe place for you to say, I don't know. Like,
yeah,
I feel like an imposter here. Like,
yeah.
And we all have those, and it's a safe place for you to really vet those gremlins.
Yeah.
And we all have them, that we just don't talk about them. So, well, maybe some of us don't have them, but I think
I think the vast majority of us do. So talk to us about some of the very practical issues that physicians face when they come to a coach, right? From any aspect of their life. I mean, we talk about the three selves in physician empowerment. There's a financial self, there's, the personal self, and then there's the professional self, the white coat, right? But just put some of these issues on the table that tend to come up. I mean, we've got burnout or career dissatisfaction or whatever, but describe a little bit about that, because I bet you somebody out there is listening going, yes, that's me.
Yeah. Well, I think that one of the first core things that coaching brings you to is actually being recognized as really a core quality as a human, as a leader, as a parent, and that's self-awareness, right? So, there's a number of different tools out there. I mean, coaching, you can take lots of leadership courses and learn lots of tools. You can take personality, profiles. There's so many of them out there. In the medical profession, you often use like Leads 360s that give different perspectives on your performance. But I think coaching allows you to do that in a very safe place and really get to know the person that you are at the very core, even the person that you used to be, the person with the dreams, that before you went into medical school, the child, within you that that had that unleashed potential and love of life. Like that coaching, if you're curious to know what is still there underneath the layers, which we all have at the core of our humanness, coaching is a great place to start. And it's an enjoyable process. I've think most of my clients really enjoy it and are actually surprised at how fun the sessions are. So it's
I like it. I like it.
yeah.
I'll tell you one thing that stuck for me was I was like, oh, this gets to be a space about me, because
Right.
so much of a doctor's life is, I mean, just speaking for
Mhm.
myself, it's going
Mhm.
into the hospital and addressing other people's needs, you know,
Absolutely.
administrative obligations to other people, meetings you're expected to attend, kids, family, everybody needs you. As a doctor,
Exactly.
everybody needs you, right? And you
Mhm.
come home and it's like you do it a second shift, right?
Yeah.
And it's wonderful. It's wonderful to be needed. And it's wonderful to care for other people. It's truly
Right.
probably one of the things I love the most about medicine is the opportunity to be involved in people's lives in
Yeah.
that intimate and close way. But you
Mm.
realize that in a given week, how much space did you have for you? How
Right.
much space did you
Mhm.
have to address your issues and what you want or need,
Mhm.
or what's
Mhm.
important to you, or to even look inside?
Right.
And I think that's where coaching is very powerful. And
Yeah.
and like you said, it's enjoyable
Yeah. Yeah.
because you get to focus on not necessarily challenges, but you also aspects of your life that make you happier and remind yourself of those.
Right. And I like that what you said, Kevin, about the making space for yourself and also you as your most important investment, right? At yourself. So that coaching allows you to prioritize some time for that, allows you to make a commitment to yourself. It allows you to have that reflections and have that time for reflections. And I think, we just go, we get on the hamster wheel and we're just going to the next thing, and right from medical school to the mid to advanced career. And then no matter what aspect of medicine you're in, there's always the next level up. So instead of getting caught up in the trance, like a video game of like leveling up, it's really nice. Coaching is an opportunity to pause and look at everything, and almost like as if you were in a plane, or you're an eagle and you're watching your life and you're watching yourself go through your mountain pass of life, and really acknowledging your strengths, your accomplishments, and learning from it, and trying to make connections and saying, oh, that makes sense now, like why I'm having this friction right now with my values. And you asked about practical tips, and in the emergency department now, as you know well, like every day you go to work and you're seeing your values you're seeing friction between your values, the care you want to deliver, the making sure that patient gets, follow up. And in our current healthcare situation with not enough family doctors, you're left with this angst of, well, I'm just putting a Band-Aid on and it's going to get ripped off and they're going to be back next week. So that coaching, I guess, can help with problems like that in terms of, okay, let's reframe what's my responsibility here? What's my role? And just making sure that internal boundaries, external boundaries are clear, which is something I'm still working on. But yeah, anyway,
But it's powerful. It's a powerful reminder,
mhm,
because those boundaries constantly
mhm.
get eroded,
Yes. Yeah.
right? And we do the eroding.
Mhm.
We are the ones that struggle
I
to say
love
no.
that, Kevin. Yeah, you're right. We are we're our
Nobody's imposing anything on us.
best friends and our worst enemies.
Yeah, we do it. And so but
True.
working with a coach, right,
Yeah.
is allows you to sort of take a step back from you and look a
Mhm.
little bit more objectively and say, yeah, I am struggling to set boundaries here. And it's
Mhm.
affecting not only my personal life, but it's affecting my professional life, because I'm not enjoying my job as much as I used to, right? And it's not
Mhm.
just like boundaries on time or scheduling. It can also be boundaries on like, how much of this am I taking home?
Yeah.
When I feel this angst, like you said, between what I want for my patients and what
Yeah.
I can practically deliver.
Right.
That moral struggle that we have in modern healthcare. And so these are the powerful things that we get to address on a highly individualized level, right? Because
Yes, thanks for mentioning that.
I struggle with one more wellness module, right? Like I struggle.
Yeah,
And my time is so precious. All of our time is so precious, right? Like I don't
exactly.
want to just do something generic.
Yeah,
That's not specific to, me as the physician, right? And that's where, again, coaching in small groups or individually can be very
yeah,
powerful, because it's like we're all that same mindset of like, okay, like let's just get this done. I mean, I think by and large
yeah.
physicians are of that view of like, well, let's start making things better. Let's make a decision.
Right.
And it's hard when you look at what I'll describe as sort of generic or cookie cutter resources out there, because everybody is it. Even if you work in the same group practice, everyone's at different ages, different stages, different backgrounds and personal struggles. So you want
Absolutely.
something that's going to be relevant for you in your life. And I
Absolutely.
think it's worth investing in,
Yeah.
right? Like I think, like, again, the challenge is, if I'm not happy and thriving now in my career, when is that point going to come? Because
Mhm.
it's not like things are going to magically change in our lives,
Mhm.
right? Like,
Mhm.
whether it's financial issues or, the healthcare system that we work in, nothing is going to dramatically change overnight.
Mhm.
And and nothing inside of us is going to dramatically change overnight. So what can I do in a concrete, if incremental fashion, to make change?
Mhm.
But you can also take big leaps. I mean, you talk about like how your career shifted,
Mhm. Yeah,
Michelle, as an outcome of coaching.
that's true. Yeah, and
So powerful.
yeah, and like it's become such a great transformation for me. I'm so much happier now that I'm getting better quality sleep, and I'm being challenged in a different way. Like my brain has pivoted to coaching and learning all about basically evidence-based neuroscience and how we can rewire our brain. How can we rewire our habit thought patterns that we've had in the past that have maybe that are no longer serving us, that maybe
I love
they
it.
got us to here, but do we want to, if we want to go to there, if we want to really get to that top of that mountain and keep learning, what do we need to do? So,
Exactly. And it takes
mhm,
time and effort.
yeah,
And I think
yeah,
that's, the hard part is the willingness to put in that time and effort for, steady improvement or steady change, if you want to call it that, right? Because it's not necessarily where there's something wrong with you per se. It's
yeah,
something could be different, or you want to go in a different direction in your life. So how do you do that?
yeah.
And this is where the coaching process and that self-work can become so powerful.
Absolutely. Yeah. There are, I think, too, financially tends to be, I think, one thing that people are shy away from coaching, but there is, I think, increasing recognition that it can be like a Section 3 credit with the
Oh, it
family
should be.
college,
Yeah,
as
like
well as,
if it's
yeah,
oriented towards practice improvement or wellness, lots of physicians
exactly.
will write
Mhm.
off their
And
time coaching.
it is, and yeah, and that is
And it is professional development, and we
professional
should
development.
have this, right? I
Exactly.
mean, it doesn't
Yeah.
have to be certified. I mean, if it's
Mhm.
professional development and you're improving as
Mm.
a doctor, this is like what we should all be doing.
Yeah, exactly.
Ideally, it's some form of like, having a, small group or one-on-one mentorship in a, like you said, Michelle, a safe space, right?
Yeah,
With somebody that has a bit of distance from your practice or your personal life,
yeah,
I think can be very powerful, because then you feel comfortable sharing, but they can also help you to see where you are on that scale of practicing physicians. Because we often think we're
yeah,
dealing with something and we're the only one. And then we discover, oh my goodness, everyone is dealing with this.
yeah, absolutely. And I like that what you said about like one of the things I just want to unpack as being really good point was that individualization of coaching. That really is what sets it apart. And also the power of coaching in terms of making that connection if you are doing it as a small group, it can powerfully create relationships with your colleagues that you didn't have before, because you're connecting as humans and you're talking about topics that are about your dreams, about your fears, some of the things that are, very personal. And then not everyone feels fair. Not everyone is able to share that in a group setting. So for those people, individual coaching is probably a better fit.
Mm-hmm.
But there are those opportunities for sure.
Well, and the two can be mixed, right? Because
Yeah.
I think there's something powerful about like going through things as a group. And we actually used to do it with Physician Empowerment. We used to do monthly sessions where we would cover deep dive topics like, things like sleep or dreams or travel or, and it was great to have people sharing, for more deep topics, or something, where you just, you want that one-on-one, there should be that option as well.
Yeah.
So, I mean, there is so much here, but I think fundamentally, and we have to wrap up because I think I could just go on and on and on.
I know, me too.
I mean, fundamentally, I think it's this idea that in our careers, we are dynamic, right? We all, I think, have it in our heads like, okay, you get through medical school, you get through residence, you get through fellowship, you start practicing, that's your life. Well, that's not true, right? I mean, kids come along, you move, you marry, things change in terms of even medical technology, healthcare delivery. I mean, our careers are dynamic. Things like the pandemic affect us. All of these events can change the landscape in which we practice. And so recognizing that our medical practices are dynamic, and that's a good thing because there's so much personal growth that comes out of that.
Absolutely.
If you embrace it.
Yeah.
And then you say, okay, so I'm not scared of change. I'm not scared of getting older in my practice. I'm not scared of aging out of night shifts or call because now I've got another great opportunity to reach for, right? That's the power of coaching, is to reframe. I mean, I love the name of your company, CoFrame, to reframe our perspective on this, right? That we can look at things differently and be happier about it. And, exercise control in the aspects of our career and our personal life where we do have control, and letting go and setting boundaries on the things that we don't. So again, I am so excited to have you coming and speaking at the conference this May, Michelle. And again, if anybody wants to connect with Michelle, I'd be happy to facilitate those introductions. So reach out to us because, like I said, I've done coaching sessions with you, Michelle, and I found them to be great.
Thanks, Kevin.
And look forward to more.
Yeah, well, it's an honor.
So did you have anything else you wanted to leave us before we sign off? Because like I said, I could just go on and on for hours, but we try to have some kind of time cap on our episode.
That's right. I'm a lot like you, so we could.
You and I can just go and go.
Well, thank you, Kevin. It's been a great conversation, and it's so inspiring to kind of align our mission, our purposes, which are very similar to, you helping colleagues to realize their dreams. And that's really true to my heart too. So thank you. And thank you to all your listeners and colleagues out there that are doing what they're doing in the daily grind. And, just to let them know that this, I love that dynamic. We're dynamic. This too shall change. This too shall pass. We're riding the waves in the ocean, and we got to help each other keep afloat. So I'll end with a joke. I passed this billboard that was on the side of the road, and it said, the three hardest things to say in life are, I need help, I was wrong, and we're Sister Sauce, which I don't even know if I'm still saying it right, but I love that because, that was a place that I think a lot of us are at during, the last 4 years, feeling as if a sign of weakness was asking for help, when we got to reframe that as a sign of courage.
I love it. Absolutely love it. So with that being said, let's wrap up, but I hope we can get you back on the podcast again at some point later this year. Thank you so much, Michelle.
Great. I'd love that. Thanks, Kevin.
Thank you so much for listening to the Physician Empowerment Podcast. If you're ready to take those next steps in transforming your practice, finances, or personal well-being, then come and join us at phys-empowerment.ca, PHYS empowerment.ca, to learn more about how we can help. If today's episode resonated with you, I'd really appreciate it if you would share our podcast with a colleague or friend, and head over to Apple Podcasts to give us a 5-star rating and review. If you've got feedback, questions, or suggestions for future episode topics, we'd love to hear from you. If you want to join us and be interviewed and share some of your story, we'd absolutely love that as well. Please send me an email at kmilo@phys-empowerment.ca. Thank you again for listening. Bye.